From the Baker Institute for Public Policy at Rice University in Houston, Texas, this is Baker Briefing. I'm Joe Barnes, a fellow at the Baker Institute and today's host. Our topic is tranq. This week, President Biden announced a new initiative to tackle the growing use of fentanyl laced with xylazine, known on the street as tranq. This combination of drugs poses an alarming and significant threat to public health. While fentanyl can easily cause a deadly overdose, the addition of xylazine has proven even more deadly. The CDC reported last month that the percentage of fatal opioid overdoses in which xylazine was detected rose by 276% in just 3 years. Here with us today to explore this topic is Dr. Catherine Neal Harris, the Baker Institute's Fellow in Drug Policy. Katie, thanks for joining us today.
Yeah, happy to be here, Joe.
First, let's set the stage. The fentanyl crisis isn't new. In fact, it's been around and worsening for some time. What do we need to know as citizens about the fentanyl overdose crisis in the United States?
Right, so as you said, it isn't new. Since 2015, overdoses involving fentanyl have been increasing. Last year, there were over 100,000 drug overdoses. About 2/3 of those involved fentanyl. Most of those also involved other drugs, right? So we're really talking about sort of a polydrug use problem. And right now, there aren't any signs that the fentanyl issue is abating.
How does the use of fentanyl and/or xylazine impact individuals and communities? Are there any notable geographic patterns or demographic patterns?
There are. So just for the listeners who aren't familiar, xylazine is a tranquilizer that's used in veterinary medicine. Synthesized in 1962, so it's been around for a while. It has not been approved for use in humans because it causes severe depression on the central nervous system. It's been commonly mixed into drugs in Puerto Rico for some time, and we started seeing it in the US, in Philadelphia, in the late 2000s. But now it's starting to spread to other parts of the country. It's currently predominantly in the Northeast, but it's been detected now in all 50 states. Its use is spreading.
The Biden administration announced a plan to reduce overdose deaths with a focus on deaths caused by mixing fentanyl and xylazine. Tell us about the plan. How is the Biden administration tackling the broader epidemic and this more narrow threat posed by this blend of drugs?
Yeah, so the plan that was put out by the White House, they had basically sort of a 5-pronged approach. And so that includes ramping up testing for xylazine, right, both at the forensic level and community settings so that people who are using drugs can test their drugs for xylazine. Another part is increasing the collection of data, also standardizing how we collect data because there's a lot of discrepancies across jurisdictions. They also want to develop best practices for treatment. Xylazine, when people do become dependent on it, there are withdrawal effects that make it difficult to treat. They also want to identify where it is exactly in the supply chain. So as I mentioned, it's a tranquilizer used in veterinary medicine, so it's not regulated in the same way that, say, fentanyl is. And so we don't know if people are getting it from the legal market, if it's getting diverted, or if it's being illicitly manufactured. So figuring that part out. And then the final part is increasing research on the drug's effects on people and also looking at better treatment approaches.
Now, beyond federal policy initiatives, what other strategies are needed at the state, county, and community levels to address both this specific problem and the broader drug problem? And can you focus a little bit on 2 items for me? Where is the Texas state government on this stuff? And what do you think personally are the most effective approaches?
Yeah, so just to start with what the states and communities should be doing, right? The federal government can only do so much. They need the cooperation of states and local officials. Right now, the issue with xylazine, it's predominantly mixed into the fentanyl supply, right? Into counterfeit opioids and into other opioids that people are purchasing. So the people that are most impacted by this particular drug are people who are already dependent on opioids. Because they're dependent on opioids, they are going to buy what they have access to. And so if the only drug that they have access to are opioids where xylazine is mixed in, then that's what they're going to buy. So really the way that you have to address that is, 1, give them tools to test for xylazine, right? So that maybe they can try to avoid it. And 2, offer them a better alternative, right? And we have 3 FDA-approved medications to treat opioid use. There's buprenorphine and methadone are 2 that are kind of the easiest to treat people with, we need to make those more accessible. Now, some places are doing a better job of that than others. There are now in Massachusetts, in New York, in Delaware, they've rolled out programs to allow for community testing for xylazine. You asked about Texas. Texas is not one of those places. In the last legislative session, the state had an opportunity to legalize testing for fentanyl. They did not do that. During the session, I and many others made many of the elected officials aware that xylazine was an emerging threat that we could also be testing for, that we needed to change the law to allow that to happen. And elected officials just didn't really listen. So we are not quite ready to deal with that problem here in Texas.
Yeah, now let's move to another area, which is law enforcement. How is law enforcement in general and in Texas and perhaps even in Houston specifically, how is law enforcement approaching the fentanyl issue and this more specific issue?
Yeah, so there's a lot of effort right now. As far as fentanyl goes, there's a variety of approaches depending on what level, right? So at the very broad scale, there are efforts to sort of crack down on the flow of these drugs that are coming into the United States. Fentanyl is a very potent opioid, right? So it's 100 times stronger than morphine. That means that it can be shipped in very small amounts, right, in envelopes. So it's very difficult, I think, for law enforcement to find it and eradicate it.
So interdiction is a huge problem.
It is, yeah. I'm not saying that there shouldn't be any interdiction efforts, but the fact remains that we have a demand for drugs here in the U.S., and as long as that demand exists, someone's going to supply it. And it poses a lot of challenges for law enforcement just because of how many different ways that we have of getting into the country and of people selling it now with the internet as well. It's very easy for people to purchase drugs if they want them.
Well, look, Katie, I think we've covered this specific issue well, and I want to thank you so much for coming. As always, you remain a master of explaining complicated issues to people like me, and hopefully people like people in our audience. But could you give us a sort of a last expression of how you think we in the United States should approach the broader question of addiction to drugs? And I know it's a big topic, and I'm not going to give you a lot of time.
Okay.
But this is your soapbox moment.
Yeah, so there's two issues, right? There's this immediate short-term problem of overdoses. We have to do stuff to stop those deaths. That's the kind of harm reduction stuff. Treatment, overdose prevention sites, immediate things to keep people alive right now. The longer-term problem is drug use and an increasingly lethal drug market that has become lethal because of prohibition. In order to address that, we have to be investing in programs that can provide people with alternatives to drug use, right? And that involves things like affordable housing, living wages, healthcare, these very large societal programs that, as of right now, we haven't been making the investment that we need to be making.
Look, thank you so much, Katie, for joining us.
Thank you for having me, Joe.
Baker Briefing is brought to you by the team at the Baker Institute for Public Policy. Baker Briefing is produced by Victoria Jupp and Shannon Moriarty. AV production is led by Kevin Young and Andrew Marijo. Intern Liza Jacob also provides invaluable research for the briefing. The Baker Institute for Public Policy provides meaningful policy analysis on the most critical challenges facing Texas, the United States, and the world. It is a nonprofit, nonpartisan policy research organization based in Houston. To learn more, including how you can attend a live podcast recording on the campus of Rice University, visit us at bakerinstitute.org. Thank you for listening.